Mental health concerns among undocumented immigrants in the United States have increased in recent years, especially among those who are undocumented. Research shows that undocumented immigrants are more likely to experience mental health challenges such as anxiety, depression, and stress than those with legal status. Despite these elevated risks, this population is less likely to use formal mental health services. Several barriers contribute to this low rate of mental health service utilization. Lack of health insurance, financial hardship, fear of deportation, and limited understanding of how to access healthcare. Additionally, stigma around mental health, language barriers, and a lack of culturally competent services make it even harder for undocumented individuals to seek help. Community insights and ethical considerations. Researchers and community advocates have spoken with clergy, church leaders, activists, and mental health professionals to understand these barriers better. These conversations reveal the need for safe, accepting, and non judgmental spaces where undocumented individuals can receive care. According to the NASU Code of Ethics, social workers are committed to respecting the dignity and worth of every person. This principle is fundamental when working with undocumented immigrants who often face discrimination, anti immigrant sentiment, and limited access to services due to shifting political climates. Legal status and mental health impact an individual's immigration status significantly impacts their mental and physical well being. Illegally accessing education and receiving public benefits immigration processes can lead to limited opportunities, discrimination, and exposure to trauma, both before and after arriving in the United States. Research shows that in states with high immigration enforcement, undocumented immigrant residents report poorer mental health outcomes. Key challenges identify limited healthcare resources, such as interpreters or culturally relevant materials, anxiety about being misunderstood or mistreated by providers, fear of re traumatization and job loss, and lack of cultural competence in mental health care. Why mental health services are underused even when services are available. Many undocumented immigrants hesitate to seek them. Includes a mental health language and cultural barriers, poverty, and fear of legal consequences. This population is also underrepresented in mental health research, making it challenging to design effective interventions. Empowerment theory is a viable tool for social workers to engage this population, helping individuals find their voice and advocate for their needs, building on community strengths, and supporting lifelong processes of empowerment. Social workers can apply this model at the individual, group, and community levels to help reduce mental health disparities among undocumented immigrants. Social exchange theory can also inform how we work with undocumented communities. It focuses on the idea that people assess the costs and benefits of their interactions. If individuals believe seeking help will benefit them more than harm them, they are more likely to engage in services. Building trust and positive relationships between social workers and community members is essential. When community members see that mental health services are helpful and safe, they're more likely to seek them out. The socio-ecological model helps us understand how various systems, such as family, schools, workplaces, and government, affect an individual's mental health. To create meaningful change, factors at multiple levels individual, community, organizational, and policy must be addressed. For example, lack of access to education and healthcare, coupled with discrimination, contributes to poor mental health outcomes. Using this model helps social workers target interventions at the proper levels. The role of community engagement. Engaging in the community is key to creating lasting and effective changes. Community partnerships, local clinics, and grassroots outreach can empower undocumented individuals to seek the help they need. Learning about a community's culture, religious values, and experiences helps reduce disparities. Social workers must affirm and incorporate undocumented immigrants' cultural perspectives when designing mental health services.